Well, good evening, good morning again from Dr. Bill Wyatt from the American Orthodontic Society. I'm going to advertise this all over the world. If you need this done, go to the American Orthodontic Society in Grapevine, Texas. And this Follicular Dynamics, and it is most interesting to learn what happens to the teeth and how it happens. And pediatric dentists, anybody working on children, ought to understand some of these things. You don't have to know it all to start out with, but you can learn it and watch it develop as you go along. So I'm going to get into this case, and I won't show too much until we get to the X-rays, and then we'll show you the whole story. Neat little girl right here, and we're going to see her for several years as she grows up. Now this is in 1998, and she comes in. She's got a little narrow case in here. She may have a little mouth breathing problem or something that's causing those centrals to come in kind of out of order and everything. And we watch her in 98, and I checked the X-rays, and I can show you those on later on. She's extremely crowded, and so we took some teeth out on this lady, and you can watch the facial structure. It's not going to shrink up. The tongue is pushing these teeth forward, and the lips is catching it, and that's where those teeth need to be. I don't give a hoot whose cephalometric stuff you teach. They can't tell you what the person's going to do exactly. That person can tell you where to put the teeth. And so here, this is 1999. Man, George, that's getting on up here. Now, we'll watch these teeth. Let me get through. We'll get to these X-rays. And we have extracted the deciduous cuspids, which I disagree with. They lose some space in there. I'd rather go in and trim them off. Now the profile is fairly straight, but this is where that young lady's pressure is pushing the teeth, and the lips are catching it at that point. And here's the looking straight at the young lady, and there the teeth are, and we've done some extractions. Now the cuspids are coming in, and you'll see this child for several years before you're through. Don't send this person to an orthodontist to do this. And if you can't hire one to work in the office, you ought to learn how to do it yourself. It's not that complicated, and there's no need of saying, well, I can't learn it, I can't do it. You can do it. Just get down and get with it, and you can learn it. Now here, we've extracted teeth in here, and the cuspids are coming in, but they're way off to the side, and we haven't done anything as far as orthodontics except make some space in here for these teeth. These are deciduous teeth. They're coming out, permanent teeth coming underneath them. And here we are again. The face is still not sunk in or anything else. Now we come in and put braces on this, and we're straightening it out a little bit, and the profile is almost perfect right there. Now we're lining up, and this is 03, so this is 5 years after we started the case. Nobody goes to orthodontic school and takes a case and stays with it for 5, 10, 15 years, which some of these pediatric cases take. And you have a chance to improve the life in every way with that person, while you see them for 10 or 15 years as they grow up. and help guide them in their life. I've helped them in talking about their boyfriends or anybody else, and help these people. A lot of them, you get to know them personally over a period of time. And here it is in '03, and they're lined up, and we have the 6-year molars. The second molars are in now. This is '03. All right, let's get on to the X-rays. And this is the X-ray in '03, I believe, right here. The upper wisdom teeth are developing, and I see something over here on the wisdom teeth. I don't think we're going to have room for them. Now, young ladies just grow to about 13 and a half, maybe 14, and you don't get enough room sometimes to swap the teeth out. But anyway, we've taken the bicuspids out, and it darn sure didn't ruin the person in here. It helped us. Now, I'm going to go in and show you what we do with follicular movement of the teeth. And I've never read a single word on any written thing on follicular movement. Maybe I have done it, but I've been doing it for years. And I was here when this organization was born, and I've been working with it for 50 years of my life, and have been doing things after that time. So I hope you appreciate that. Now here we've got a case, this cuspid coming in. What are you going to do with it? Well, we're going to go up in there and get something out, and so we'll take a first bite, apparently. And here we take the deciduous tooth. I look like I trimmed it down and then took it out, and then went and cut this one off right here. Let that tooth go back in there, and let's see what happens. This is 1997, and anyway, this is 78, and we're still watching this case. 1998. All right, at age 9-4, right up here. I can't get the date on that pretty good, but anyway, we see what we've got to do. So we take this out. This is up against a hard surface over here. When this is gone, this bag around the tooth is going to move that tooth over into this position right there. Now, we are not doing anything but giving them some room and taking out and let nature guide those teeth into place. Look where this tooth is running, right on top of the lateral right here. We got a little space in here. These will move together when that comes down. That follicle will move that over, and the cuspid will push that back in place. Now look down on the bottom down here. Pediatric dentists ought to be doing this kind of stuff. I don't care who you are. And then I'd like to shake somebody's head that's head of that, and telling the pediatric dentist, you don't have sense enough to do this. Now you can do it. And so here we're going to come in and take those teeth out. And now this is 5/11 of 99, and we took the teeth out. And you know how to do it. Look where that tooth came. It moved around. The follicle moved the tooth. The follicle moved this tooth, moves this tooth right in here. And in the meantime, these teeth are coming forward from the back side. Let's go back and look at that, and you get a little appreciation for what's happened here. Look what a mess you have here. You either got to expand the dickens out of it and get it out here, and then it's expanded against the lip structure that really doesn't want it out there. It's lined up, and that's where the pressure is, from the inside and the outside. And that's where you want to keep these teeth, though. They stay there because that's where the natural force is on the teeth. And so we adapt our treatment to nature. So we're going to take this out. Take this out right here. And who in the devil says people are married to somebody with a big broad face and they have a wife or maybe somebody else with a narrow face and the teeth don't fit, and so we make them fit. I've been in Africa. I worked for 3 solid years there and went into a village, a pretty good sized village, and there was not one person in it wasn't bimaxillary protrusive, and everybody in that school had straight teeth. They didn't mix up. You come back here in America, and we're the most mixed up people you ever saw. And we can't be mixed up without somebody married, somebody who's got a thin facial structure and they have a broad facial tooth to stick in there. And that happens. All right, watch what happens here now. Let's look at that close, and I'm going to poke that, and you watch where that teeth went. See where they went. Now watch, they'll go for another. This is age 10 too, and this is 90 or something there. All right, it goes to that point. Now it comes to that point. Haven't touched it yet, other than extracting and making room for those teeth to come in. So here in 02, we put braces on them, and we're going to touch them up a little bit, but that person could go the rest of their life and never have braces and still have fairly straight teeth. I don't know what, so we've got upper wisdom teeth and one on the lower left, and I don't see anything on the lower right. So she probably lost the wisdom teeth, and the jaw isn't quite big enough in there to get this tooth in right there. Okay, we haven't done anything with the wisdom teeth, and we line those teeth up and straighten it out. And the retention in here is very mild. I mean, you might not even have to, but you want to keep a nice straight form. So we put a retainer on. This is 1998 at this point right here, and she's 9'1". Now that's 99, and here we are at 01. And here's our little girl when we finish up with it. And don't think you can't do this. You can do it. And anybody working on children should raise so much fuss that the people training pediatric dentists and the dental schools all over this country and all over the world would allow a pediatric dentist to do orthodontics just like putting fillings in or anything. And you can follow these people through. You just don't send them over for the orthodontist. They don't even get trained in learning how to do this. So thank you for watching, and I hope I haven't hacked you off, but this is the way I feel about it. I do not agree with lowering the quality of our people that we pass the boards to, and I tell somebody, if you, by George, can pass the boards of the American Orthodontic Society, you darn sure can straighten teeth. And that's a fact. and I don't appreciate somebody cutting down the quality so we can get more people on the board. What do you want to do that for? People need to study and really work on that stuff. So that's my opinion here. So I'll hush up and close that. I appreciate you. I hope you follow these, and I'm going to cover every aspect of orthodontics here, that I've changed many things in it, and I have not read very much of anything. I just think about it and study it myself, and I've listened to people talk. So I hope you understand this. This goes to the end of the world out here, and people will write in and thank you for it. And if you've got a better way of doing it, let me know about it, and I will certainly adopt it. This is church. This is the truth as best I can give it to you. Thank you.